Welcome back to the hysteroscopy series. This is a case of advanced carcinoma of cervix with involvement of the anterior parametrium. So I'm doing a cystoscopy and a hysteroscopy to stage the disease. We all know that this patient is inoperable because the lower vagina is involved and there is parametrial involvement. The cystoscopy is being performed to correctly stage the disease. If the tumor is infiltrating the bladder mucosa, it upstages the disease. As you can see, I've entered the urethra. You can see the right ureteric orifice, which looks completely normal. This is the endotrigonal area, which also looks normal to me. And I'm looking for the left ureteric orifice. I am using a 2.9 mm hysteroscope to perform the cystoscopy. It is a rigid scope. I then evaluate the entire bladder. I look at the mucosa, I look at the vascularity, presence of any edema, any mass which is protruding, and in this patient, it all looks normal to me. Had there been a mass in the bladder, I would have taken a biopsy of the mass and a separate biopsy of the cervix to prove that the same tumor is infiltrating the bladder, and this patient would be deemed as stage 4A. Because the female urethra is just 3 centimeters, it is fairly easy to perform a cystoscopy in females using the same hysteroscope. Coming out of the urethra and now entering the vagina, I see a hard vaginal nodule. As I go inside and look for the cervix, I realize that all the fornices are obliterated. The vagina is not distending as a normal vagina would. The cervix is fixed, hard, and quite friable with abnormal vascularity all over. For correct parametrium assessment, a rectovaginal or a bimanual examination must be done. You should slide your finger till the pelvic sidewall to understand whether it is involved or not. In the earlier days, cervical cancer was always staged clinically, but FIGO now accepts imaging such as MRI, CT, or PET scan or pathological findings rather than just clinical examination for staging. So, for example, on MRI, if the pelvic lymph nodes are involved, then the patient automatically becomes stage 3C. You obviously need a cervical biopsy to confirm the diagnosis. In this case, I have taken two separate biopsies, one from the cervical os, the external os, and the other from this vaginal mass that you can see. This patient's report came back to be moderately differentiated squamous cell carcinoma of the cervix, stage 4B, since inguinal lymph nodes were involved. Thanks for watching.